We have 4 major campuses, about to build another hospital, and we have a collection of almost 70 clinics providing care throughout the Puget Sound area. One of my objectives has been to design a true electronic medical record, bringing in the components that are externally generated as well as those that are signed or that have some third-party piece. The objective there is obvious. We want to make sure that all of the information is in one logical location.
Users all across the system will have to be trained in the electronic health record, and so that includes everybody from billing to scheduling to patient registration, pharmacy, radiology, surgery, doctors, nurses. 5 out of 6 employees in the 7,000 employees plus that Swedish has will need training in the electronic record. And the challenge was to figure out how to develop the training material so that it was specific to them and still do it in an efficient way.
With our process that we've been able to devise, we have been able to, at the desktop in front of the patient, be able to address the patient directly, take their information, scan it through the scanner, give it back to the patient while I'm still facing them, and able to correct or add their information into the system, committing that into the repository within Stellent or Oracle, and then being able to have that information resident so I can pull it up within Epic for any of the caregivers further on down the line.
I realized that I was going to need some kind of document management system. So ImageSource was able to come in and do a really great job of assessing my business needs and being very thorough and understanding what my requirements were, understanding the tools that I had at hand, both the Stellent system and the database that I had already developed. So the Stellent software allows me to go in and check off which documents I want to have for that particular role. And then it compiles that for me and creates a PDF file, and then I can send that PDF file to the printer. When we make a change in a chapter, I can go out and regenerate the manual, and now I have the latest version of those chapters in that manual. And so it makes version control really simple because it always will generate the latest version based on when the documents were checked in.
We didn't want our users to have to learn 7 other programs. To them, they only see one program, one interface. They logged in one time, and then from within Epic, they would launch a scan or they would launch a view of information that was actually held within the content system.
Rather than imposing an outside solution on me, we really worked very hard and diligently with me to create a solution that fit my needs exactly. So something that I can do with the Stellent ECM in about 10 minutes would have taken a half a day or a day or more, depending on how extensive the changes would be.
We've gone live without a hitch. It's been great. The users love it. It saves them having to get up, go make a photocopy, turn their back to a customer or to a patient, and be able to provide better care and better contact with our patients. They have a greater sense of security in knowing that we're providing better health care for them.